Hi, everyone. Good afternoon for me from Harrisburg, Pennsylvania in Eastern Time. Good morning to those of you in other parts of the country. I'm Louie Marven, and here on the screen you see that we're from Elevate Uplift, and we're talking about strong foundations for meaningful services for survivors of sexual violence. And I'll just briefly say that I'm with the National Sexual Violence Resource Center, where I'm a project coordinator. And this is one of many projects that I get to work on. And I'm glad to be here today with Val, who I'll pass it to introduce herself now.
Thank you, Louie, and thank you all for being here. My name is Valerie Davis, and I am zooming in today from Cedar Rapids, Iowa. So I'm in Central Time, so it's still morning for me, and I'm still drinking some of my coffee. Did I say where I work? I work at the RSP at the Iowa Coalition Against Sexual Assault. The RSP stands for the Resource Sharing Project. And I am also one of the project partners on our Elevate Uplift project. And I coordinated the training and technical assistance for the Sexual Assault Demonstration Initiative, which we often shorten to SADI.
And I'll tell you a little bit more about Elevate Uplift. So we believe survivors of sexual violence deserve the care and support to heal, and that community-based organizations like the ones that you're all joining from have the power to provide support to survivors on this path. And when rooted in a deep understanding of sexual violence and using a framework of trauma-informed and healing-centered care, organizations like yours can make a difference in the lives of survivors. And so our work is to help organizations do that. And so Val and I mentioned our organizations. There are a number of other organizations that are part of Elevate Uplift, including NAPISAV, which is an acronym that stands for the National Organization of Asians and Pacific Islanders Ending Sexual Violence. Also MUSAC, the Minnesota Indian Women's Sexual Assault Coalition. And soon we'll be partnering as well with CISE, which is the National Organization of Sisters of Color Ending Sexual Assault, and Mujeres Latinas en Acción as well, in addition to NSVRC and RSP, where Val and I are joining from today. And then on the screen, we have a few of our programs or the things that we do that you can access. So it says changing practices, supporting healing. The first practice that we have listed is community conversations. So we have some of those available occasionally. There aren't currently any scheduled. We're getting some new programming planned coming out soon, but that's just something to know that we do. So conversations that will help improve your practice and expand your perspectives. We provide support for evolving programs. We provide assistance for organizational growth, and then we do training and consultations like this. And that's trainings for coalitions and organizations. And we have a lot of resources available on our website, elevateuplift.org, which we'll link to later on. And yeah, I'm going to pass it to Val to talk about the background of the Sexual Assault Demonstration Initiative.
Thanks, Louie. And so Elevate Uplift, as Louie has just been talking about, is the next phase of our project that originally started in the SADI. So the project partners that Louie mentioned on Elevate Uplift were also the project partners on the SADI. And the SADI was the Office on Violence Against Women, often called OVW, their first large-scale project to really learn about the needs of dual and multi-service programs, meeting the needs of survivors of sexual violence. So the SADI arose from this need that was identified in the field, where most services for survivors of sexual violence are provided by programs who also provide domestic violence services or other, right? Lots of different services, whether it's homicide survivor services, counseling services, child care, health services, you name it. And folks were expressing and sharing that they were really having trouble meeting the needs of survivors of sexual violence. So the SADI started, and we worked with 6 project sites over the course of like 4 or 5 years. I don't even remember now. It was a long time. And by working with them, I mean, we met with them every week, at least once a week. We met for 4 or 5 years. We also met with the entire group of project sites monthly on webinars, but then also we did a lot of in-person work at the time, where the TA providers would travel to the project sites, and we would bring all the project sites together for training, intensive, more technical assistance support, things like that, to really learn about and see, what their challenges were, and then what steps would help them overcome those challenges, right? So the SADI was founded in this idea that organizational change is what it was going to take in order to for dual and multi-service programs to better serve survivors. And how we came up with the lessons from the SADI that I believe Maria and Agata and Itzel have shared with you all before, or maybe you've come to a different, some of you might have been at our conference in 2019, or have come to other Elevate Uplift events. But today we're going to talk about the lessons, which were identified when it was an issue that multiple project sites faced. So if it was just a situation that one project site experienced, or one challenge that was only at 1 or 2 project sites, those were not included in the lessons. So the lessons were more broad ranging across all of the project sites. And then that's how we identified themes. And so, again, thinking about the SADI lessons are all rooted in organizational change. And so the lessons ask us to really be self-reflective and think about and take actions to change our programs overall in order to better meet the needs of survivors of sexual violence. And we know that programs across the country are doing the very best that they can do, and are doing this work because they have passion for the work. And I spent 15 years working in a dual multi-service agency as an advocate and as a director. And I know that I needed to, when I was a director, I would have loved to have these lessons available to me in order to improve my program. And it's not because we did anything bad or wrong. I know that sometimes folks hear this and they're like, oh my gosh, I've been doing this work for 40 years and I've been doing it wrong this whole time. And that's not what we're trying to say. We're just trying to identify challenges that we've all had in dual and multi-service programs, and perhaps in other types of service programs as well, to now do better. So it's not about doing something bad in the past. It's about having lessons to help us move forward. I know that was a really long-winded thing, Louie, so I apologize for that. Yep. I mean, I guess I could add around the strategy steps that Louie kind of like passed by. I believe that some of you have already heard some of this information from the last webinar that you all attended as part of this group, where you were introduced to the idea of an organizational assessment. So the process that we learned, or that we used in the SADI and learned, was all of our project sites went through a process of a community assessment where they listened to the needs of their community and identified what the community thought about sexual violence, what they thought about the needs of sexual violence, what they thought about their organization. Took that information and paired it with information that they learned through going through an organizational assessment. And that's that picturing your program tool that maybe some of you have seen. And later on, towards the end, we'll put some links in the chat box for some of these tools. So they took information they learned from organizational assessment, paired that with community assessment, and then made a plan for implementing the changes that they have identified that they wanted to implement in order to, again, have this strong foundation for serving survivors of sexual. And you can skip that slide, Louie.
Thanks, Val. So that's the background on the SADI, and we're going to get going on some of the lessons. And what this is going to look like is that Val and I will talk through the first 4. We'll do a breakout room activity. We'll come back and talk through the next 4 and do another activity. So that's what we've got in store today. So lesson 1 is that a program must have an understanding and direct response to oppression and racism to carry out effective and accessible sexual assault services. So we found that when programs ground themselves in knowledge about racism and other forms of oppression, advocates are better able to understand how social norms and values shape their programs and their communities. And so then they can begin to shift the way in which they and their program connect to their communities and survivors. And a commitment to anti-racism becomes real and effective when it's fully integrated into the program's mission and daily activities. So looking at places like mission, values, staff work plans, agency strategic plan, and then assessing how effective our words are in those places for actually doing anti-racism and anti-oppression work. So I wanted to offer just a couple examples from just the organization that I work at, which I wouldn't say necessarily is a model organization, but I think that we certainly try to live these lessons and learn from these lessons as well. So I think that, as national technical assistance providers, we're right here in it with you all and trying to operationalize these lessons. So one of NSVRC's guiding principles says that we believe sexual violence is rooted in power inequities and is connected to other forms of oppression, including ableism, adultism, ageism, classism, heterosexism, racism, sexism, on the basis of religion, and other constructs that value certain people or groups over others. Yeah, so I was just talking a little bit about some of the ways that this lesson informs, or this lesson we've tried to talk about I can hear in the chat. That's a good thing to see. Great. Sorry. So how this commitment to anti-racism and anti-oppression becomes real and effective when it's integrated into all of our mission and our daily activities. So, we just, something that we hear and have heard in providing technical assistance is that anti-racism can sound great until we expect people to actually do something. And sometimes organizations hit a wall there, like having nice marketing materials that talk about anti-racism, but then maybe having issues related to pay equity or succession planning being a different thing. So I think, really living this lesson can mean having some of those things written down, but also being able to figure out how those expressed values are actually changing the things that we're doing. And so I want to say about this lesson, and really all of them, is that they're very interconnected. So as we talk about the other lessons, be thinking about how anti-racism and anti-oppression are inherently part of those, and so forth. I think you'll see a lot of connections between the different lessons we'll be talking about today. So Val, would you talk about lesson 2?
Yeah, and before I talk about lesson 2, I just want to give context. We have them numbered on the slides, or maybe even sometimes how we talk about them. But outside of the anti-racism lesson, which we have listed as number 1, there was no ranking of importance when we listed the 8 lessons 1 through 8. So they're not ranked, although we did purposely choose and intentionally choose to put anti-racism as number 1, as sort of like a reminder, and to rise it to that level of importance that then all the rest of them share equally. So the next lesson that we often talk about is around having a clear organizational identity. So to be truly effective, programs must have a clear organizational identity as a provider of services for survivors of sexual violence, recognizing both the overlapping and the distinct needs of survivors of sexual and domestic violence. It's not merely a matter of philosophy. It also has practical implications for how dual and multi-service programs are managed and how they account for their work. And so some of the ways that this lesson showed up in the SADI, and I think probably across, at least 4 of the 6 project sites. 2 of our project sites were culturally specific programs who had not previously done a lot of sexual violence work. And so I don't remember if it showed up, this particular lesson showed up with them in all the same ways that it showed up in our 4 other project sites. But during the community assessment and asking community members, community partners, some of our project sites talked to survivors, some of our project sites put out surveys. The things that they learned that their community thought about their organization was number 1, that they were the domestic violence program, and didn't even know that they were also the provider of services for survivors of sexual violence. And when they did their organizational assessments, they identified that all of their materials, whether that would be their organizational name or their mission statement, their policies and procedures, their marketing materials, their website, was really all dominated by information about domestic violence. And when talking with the board members of the organization, the volunteers of the organization, the staff of the organization, folks came to this work to work at the organization because of domestic violence. Like, they knew that was the need in the community, and so that's what brought them to the organization. And so this, of course, then, right, it creates a cycle effect where the things that we're good at, the things that we talk about, the survivors that we see and serve are survivors of domestic violence. And so it really creates this difficult position to be in, to identify what direction to move in, what to prioritize, what strategies to implement. And so our project sites undertook this overhaul of, some of them looked at their agency name, and one of our project sites did end up changing their organizational name during the time that we worked with them. And if anyone is even considering that, to make sure that when you plan for the amount of time that it takes, but that you have to start with board buy-in if you're a community-based advocacy program, because obviously that level of change of your organizational name or mission statement, that requires your board approval. And so you want to start working with your board at the beginning of that. I do want to mention that for tribal programs, one of our project sites was a tribal program located within the governmental agency of their social services, and I think also law enforcement organization. So it was a government rather than a community-based organization. So some of these organizational change strategies, or again, looking at your name or your mission statement, is not going to be something that the department was able to do on their own. Obviously, it would take all of the support of their whole agency. So it was, what they needed to do was find ways to elevate sexual violence within all the types of crimes that they were serving and all the survivors that they were serving. I'm looking at our time, Louie, and so I'm going to stop talking about organizational identity, and we can move on to the next lesson, which is around policies and procedures. So the next lesson is that sustainable sexual assault services require explicit and agency-wide support. Policies and procedures, so things like job descriptions, agency forms, organizational chart, make sexual assault services more integral to the organization's work, ensures that all staff has clearly defined roles and responsibilities for the sexual assault program, and supports trauma-informed work. So one of the things that I want to make sure to highlight as programs think about their policies and their procedures, and again, those are more than maybe what we just think about as policies and procedures. We're lumping like all your organizations like paperwork together. It's tempting to just go in and add "and sexual assault" to all of their already established policies, procedures, job descriptions, those types of things. And I know it's tempting, but that isn't really going to create that strong foundation for which you're going to build from for your services for survivors of sexual violence. And so you really want to take a look and go through and review all of those materials and really develop specific to sexual violence language, philosophy, all of that kind of stuff into your paperwork. And so we do have in the Picturing Your Program toolkit, there is a Pages to Practice exercise in there that will help you review these things with guiding questions to look at, to just help you, again, establish where you're at right now with your policy and procedures, so you'll know where to go from there. And then we also have a tool that isn't published, but we could share with the coalition for you all to have we're just waiting for design and for translation into Spanish. Really about some guiding questions to help you also in thinking about policies and procedures, in particularly specific policies, some guiding questions around that. So we'll have some tools to help you. Do you want to go on to the next one, Louie?
Yes, thanks, Val. The fourth lesson then is that stable and empowering leadership is fundamental to successful organizational change, and that stable and empowering leadership requires using direct, open, and transparent communication. So the SADI found that organizations that accomplished the most comprehensive changes were led by people who demonstrated trust in and empowerment of their staff. And so the extent to which leaders encouraged collaborative approaches to problem solving influenced the extent to which the program could grow and change. So stability of leadership was also found to have a strong influence on the program's stability itself and the readiness for change, so that any transitions in leadership are a significant change in and of themselves. Some things to think about here have to do with things like how long has the current leadership been in place, and is there succession planning that's been done? And we also want to think about what the relationship is between the leadership and the larger organization staff. Is there open communication? Are there regular performance evaluations? And when we talk about this word empowering, empowerment can look like people with kind of the formal power in the organization demonstrating an ability to share that power and to step down when appropriate or necessary. We also would look for things like people in leadership encouraging the staff to solve problems together. Some of the policies and procedures that Val was just talking about, an aspect of stable and empowering leadership is making sure that those are clear and that there are opportunities to be supervised, to have your performance reviewed, and for staff to do professional development. And really that people in leadership are practicing direct and ethical communication and teaching those skills to others, and expecting and encouraging them to use those skills as well. I think I'll leave that at that for now, so we can get to our breakout room discussion. I see you nodding, Val, so I think you think that's a good idea too. So this is what we are going to ask you all to do. So on the screen it says breakout discussion. What would it look like if we carry out the lessons at your organization? So in a moment, you're going to be prompted to join a breakout room, and you'll have 10 minutes in that space. And so the first thing that we'll want you to do is select one of the 4 lessons that we just reviewed. So we want you to choose one of those and then discuss what your program would look like if that lesson was fully realized. And then also, what's one action step you can take to start working on that lesson? So you're not going to solve this in those 10 minutes, but just to start thinking about just one of the lessons as a group, just discuss what your program would look like, again, if that lesson was fully realized, and come back with one action step you could take just to start working on that lesson. And then Val will facilitate a little report back time.
Instead of doing like a bigger debrief, would you all want to just share, for those of you who would like to share, in the chat box, just some of your thoughts about some of the actions that you identified that you could take to start addressing the lesson that you chose? And then once Louie joins us again, we'll get started.
Just very briefly, lesson 5 is that programs must tend to the well-being of staff and the organization as a whole. So the way that programs supported their staff in the SADI was seen to influence the quality of the direct services offered. So this can take the form of practices and approaches that reduce the potential for vicarious trauma. It's good when, of course, staff are given regular support and trauma-informed supervision. And support for staff also means that staff who have experienced sexual violence, who are survivors themselves, feel respected by the program. Some key things to think about here are support for staff development, individualized training for staff and staff development plans, caring for staff as whole human beings, which can include a whole range of things, including adequate paid time off, and then the encouragement to use that time off and structures that support using that time off, so not just lip service. Reasonable and compensated on-call time, attending to the specific emotional and physical safety needs of advocates of color and advocates from marginalized communities, and benefits that support health and well-being, including access to counseling and healthcare. Empowering the staff to make to be creative and make decisions that connects to what we were talking about earlier with empowering leadership, access to regular supervision, vision, and debriefing. So not just moving on to the next thing, having formal processes for debriefing and for emotional support. And yeah, I just emphasizing again, proactively addressing vicarious trauma. So that's the 5th lesson.
Yeah, thanks, Louie. And I can't reiterate enough that the direct link between how staff are supported and the quality of services that are being provided, that there is that direct correlation. So I know oftentimes I'm asked by advocates, like, what can I do to get my leadership at my organization to care about these lessons, or to care about, in particular, caring for staff? And to me, one of the key messages to convey to leadership is that direct link between how well staff is cared for is then connected, obviously, to then how well cared for survivors are in our program, which is what programs are existing for, right? Is to provide services to survivors. And so the next lesson that we're going to talk about is around sexual assault specific training. So programs need to prioritize in-depth foundational and ongoing sexual assault specific training. Sexual assault specific training needs to integrate trauma-informed and anti-oppression frameworks to address the unique and multifaceted needs of survivors of sexual violence. Sexual assault training also needs to prioritize advocacy skills that are based in active listening, empathy, building rapport, empowerment, and collaboration. And so one of the ways that this need for training really rose up and was a theme across the project sites was in talking with folks about services for survivors across the lifespan, which is another lesson. But trying to figure out what services do you think that your program would like to offer to help meet the needs of survivors across their lifespan and throughout their healing journey? And programs were sharing with us, advocates were sharing with us that they didn't know what the long-term impacts were of sexual violence, so that they weren't then able to envision what some of those services might be, because their whole program was centered around immediate crisis. How do I support a survivor with a forensic evidence exam, or accompanying them to a law enforcement appointment, and not maybe some of those more longer term needs that many and most all survivors of sexual violence have, and especially for adult survivors of childhood sexual abuse, who those two services, forensic evidence exam and a law enforcement interview or appointment, they're not relevant to many survivors, and in particular to adult survivors of childhood sexual abuse. So we identified that, like, at the very beginning of your advocacy career, needing that strong foundational understanding of the broad spectrum of sexual violence, the continuum of survivors, the lifespan impacts, and the healing journey. And then having ongoing training related to sexual violence. Because in particular, we found with rural programs who might not get as much practice working with survivors as more town or city-based advocacy programs, having more population than having more access to survivors. When they weren't able to use their skills and share the information as much, they did, right? You can't hone your skill, you can't practice it. So making sure that you have more training, ongoing training, will help keep that more fresh. And so I'll end up putting in the chat 3 like training resources. One that we put together that is for more, and I hate to use this term, and now all of a sudden I can't think of the term I prefer to use. So I'm just going to say mainstream, traditional, dual multi-service programs. We put together a foundational advocacy manual, as well as then we want to refer folks to some culturally specific training manuals as well from our project partners. So MUSAC has a foundational training curriculum specific to tribal programs, and then NAPISAV has a curriculum specifically for serving folks from API communities. And I'll put those in the chat. And Louie, do you want, oh, or no, am I the next lesson? No, or you are. You are.
It's me. And yeah, you know, a lot of this really overlaps and pairs nicely with what Val was just saying. So lesson 7 is that programs need to offer services that meet the needs of survivors of sexual violence. When programs lack that foundational understanding of sexual assault, trauma, and advocacy, they gear their services to the tangible services addressing immediate physical needs. But beyond the crisis-focused needs, there are diverse, wide-ranging needs and experiences of sexual assault survivors. So programs have to address the entire scope of survivors' experiences and the range of needs beyond immediate crisis response. And again, we can think of anti-oppression and empowerment-based frameworks that can help programs respond to these multidimensional needs of survivors. And those approaches also help us, you know, think about the value of believing that survivors are the best experts on their own experiences and addressing the physical, social, emotional, and spiritual needs of survivors and their families. Yeah, so think back again, this connects really well with about how we defined our services. Lesson, I think that's number 2. And then lesson 6, where Val was just talking about training. And yeah, so comprehensive services might look like these kinds of survivor-focused services, individualized support, certainly advocacy that meets the whole survivor, maybe that medical advocacy and legal advocacy in a more immediate sense, but recognizing that that may not be what everyone's needing across the whole lifespan. You know, helpline maybe support groups or circles of support, not just talk therapy, but art, movement, culturally rooted practices, and other things. Holistic healing, so things that activate creativity or meditation and mindfulness, possibly outdoors activities or different culturally rooted activities and ceremonies, survivor activism and involvement in the movement as well, possibly support for significant others, and all be programs, and all be services that programs offer to meet the needs of survivors of sexual violence.
Thanks, Louie. And our 8th lesson is about bravely embracing change and growth. And it really is the lesson that brings all of the other lessons together. So it says strong programs embrace change and growth. Enhancing sexual assault services in dual multi-service programs requires that programs acknowledge that survivors of sexual violence are not getting what they deserve. It requires openness to more radical changes than making tweaks to existing programs. Programs must bravely engage in an honest and critical self-assessment that includes reflection on whether, as an organization, they are ready to say, we don't know what we don't know, and accept feedback in all areas, including those where they thought that they were doing well. And so I know, like, we're getting close to time, but I want to say one of the things that even me as a director, former director, and as a technical assistance provider at the start of the SADI, many of the things that we thought that programs were going to need to do, or that that's where to start, was adding a support group, adding an outreach program for a specific population or community in their community. Adding a SANE program, a sexual assault nurse examiner program, just all of these different programs. And what we ended up learning is you can't have just those tweaks to your program to really make it a robust program for survivors of sexual violence. You need that foundation of the things that Louie and I have been talking about. I think about, you build a house, you build a building, you build your program, right? If you have a whole bunch of stuff built up on a weak foundation, it's going to topple over, right? And so it's that strong foundation that is going to keep your program providing, quality, good services for survivors of sexual violence, and developing a clear picture of your program's capacity for change and growth is a journey. And so it starts with knowing where to go. That's your growth. And that requires then to first uncover where you are at, where you are starting from. And that's the ready for change. And I think that's one of the things that this project that CCASA has for all of you, or some of you, is this ready for change place to start to build that foundation. And so I'm just so glad that you were with us today.
Thanks, Val. We obviously are not going to do the breakout discussion that's on this slide, but we just want to remind you of the questions that that we posed the first time and this time. What would your program look like if this lesson was fully realized? So keep that as a question that you can use to imagine what your program could look like, and this question of what's one action step you could take to move forward, I think is a good one to kind of get started. Thank you so much. I did see that there's a link in the chat to a survey. And I also said, let us hear about the tech issues. Thank you all for sticking with us through the tech issues. And so I'll echo that on behalf of Val as well. Thank you so much for sticking with us through this. You have our contact information there on the screen. And as Val said earlier, we'll follow up and talk with Maria and everyone about what we can do next. So thank you all so much.
Bye, everyone. Thank you.
Thank you, everyone. Thank you to our presenters. You all did great with all the tech issues. Again, we apologize for that. We thank you all for sticking with us one more time.